Today it might appear here, the other day here, just anywhere, and you won't even realize it's coming.
The patches were more visible on the lips and also in the feet, the groin area.
Usually they come with one small patch or particular maybe 2-3 patches around the body rather than when you have it all over the body.
Look at you and then they say because you have taken too much alcohol, that's what is burning your lips.
So many things, you are cast or just so many talks, and when people talk like that, you get depressed. Because when the doctor told me that there is no cure, so what am I supposed to do?
Unfortunately, what everyone thinks is that there is no treatment out there, which is a myth.
You can see me today with vitiligo, you can laugh at me today because I have vitiligo, but tomorrow it's you. What will you do?
And then they really tend to wonder what kind of disease is that.
Vitiligo is our topic of discussion today. To some of us, it is a new term and condition, while some have actually heard of the condition and either have a slight understanding or no understanding at all, while some of us actually have vitiligo. So here is an opportunity to learn, understand, and have an in-depth knowledge of vitiligo. And to those with vitiligo, it is a wonderful opportunity to also learn, create awareness, and embrace themselves. Karibuni sana to Health Nuggets. My name is Aida Munzati. Health Nuggets starts now. Let's learn together. As mentioned earlier, we are looking at vitiligo, an autoimmune condition in which the skin loses its pigment cells, hence losing its natural color by appearance of white patches. Dr. Hashim and Dr. Odera are dermatologists, and they are going to help us understand vitiligo further.
Vitiligo basically is one of the acquired pigmentary disorders we see in dermatology. And it's where basically in common sense, common terms is when the body itself or the cells that the body has starts losing the ability to form pigment. And basically that's when it's basically the cell which is called the melanocyte is the one which is basically being lost from the cell, and the melanin, which is the pigment itself, is now not produced, and hence the whitish patches of vitiligo start coming over the patient itself. So initially they can start as small, very inconspicuous or small discrete patches. And then they start as the vitiligo progresses or gets worse, the patches become larger and they even extend to other parts of the body, yes.
There are some facts that we cannot ignore. Vitiligo is not contagious, it's not painful, it's symptomatic. It doesn't have any sign and symptom apart from that change of color. And vitiligo is not only the condition that can make you have that an element of depigmentation or loss of color. So even before we say somebody has vitiligo, we must also be in a capacity to rule out a condition like leprosy. Yeah, because leprosy can also cause an element of depigmentation.
In terms of especially parents having a vitiligo, there is always a chance that one of the children, or maybe even down the line in terms of grandchildren, may develop vitiligo, but it depends. You see, with genetics also comes the other theories I was talking about. So a person should be, genetically predisposed, but not just in terms of one genetics itself. There can be something like oxidative stress, for example, or particular metabolic problems like, for example, a thyroid problem or an autoimmune condition like Hashimoto's thyroiditis. That itself may be other causes, not just the genetics per se. So it becomes very hard to pinpoint the cause of vitiligo, but usually the presentation for all of them is generally quite similar.
Having understood what vitiligo is, we will get back to Dr. Hashim and Dr. Odera in a few to understand more on vitiligo diagnosis and management. Now, Felix Owiny was diagnosed with vitiligo at the age of 10. Some said he was cursed. Others said he was an alcoholic. Some looked down upon him as the white patches of vitiligo kept spreading from his arms to his eyes, lips, and other parts of his body.
So when a spot came here, that's when I started to worry. Yeah, I started to worry my parents, like, we should check on this thing, what's this that's happening to you. So I started visiting hospitals, started going to hospitals, even the doctors there. I started seeing doctors, they didn't know what's happening to me. They couldn't tell. They just used to give me creams to apply, but with no change. So it started to spread all over, like my neck area. It was just a small spot like this, but nowadays I am seeing it's increasing. It just started here, but this spot was not increasing. It just went to these places. But nowadays I'm seeing this spot increasing. I don't know why, but it's just like that. Today it might appear here, the other day here, just anywhere, and you won't even realize it's coming. You'll just see a spot. You'll just wake up and see a spot. From then I started doing my research, because the doctor told me, like, there is no cure for vitiligo, but you can just use some creams to, like, control it. It started to worry me a lot, because when the doctor told me that there is no cure, so what am I supposed to do? Yes, there is no cure. What am I supposed to do? And back, people are looking for you, like, on a different perspective.
With vitiligo, it's very unpredictable. Any race of patient, meaning any skin color type, can definitely get it, and any age of person can definitely get it. So usually it's presented in early ages, yes, definitely, but it's not that older patients cannot get it as well. It's all throughout the spectrum, and that's why I say the causes itself are the ones that cause this particular ambiguity in the presentation of the disease itself. Yes.
Okay, so let us look at the diagnosis.
Yeah.
And when we look at vitiligo, there are
Yes.
some patches that haven't spread yet.
Yes.
And we have the ones that have spread throughout
Okay.
the body that
Yeah.
one can easily confuse it with, let's say, albinism.
Okay. So let's start with the types of, you can actually put it as more of the types of vitiligo, which is basically mainly differentiated into segmental and non-segmental in terms of what areas of the body are involved. And usually the commonest ones or the commonest areas of involvement in terms of the body are usually the face, the neck areas, and then generally the body and the hands in that particular order itself. But it's very, very different for different individuals and different races, for example, in terms of presentation. So whenever patients present, usually the pigmentation change, they will have noticed it maybe themselves or someone else might have noticed it. So the time period they might have even come with that particular pigmentation might be very different. So one, in terms of the time period people are presenting with, becomes a bit of a tricky situation. And two, when you're diagnosing it, it's not just the color itself, but the type of color as well. So the second type of classification is the color itself. So there is what we call trichromic, quadrichromic, pentachromic, in terms of the different pigments which are seen in that particular lesion or the white pigmentation itself. So the commonest presentation, usually, especially with our patients, is an early presentation, because everyone gets a little bit worried. So usually they come with one small patch, or particular maybe 2-3 patches around the body, rather than when you have it all over the body, which is the generalized or the universal type. So when you have it over the small areas itself, especially maybe around the neck areas or around the mouth itself, usually it presents with just initial reduction in pigment, and then you will see maybe some spots of repigmentation itself, which we call the trichromic. So trichromic vitiligo definitely has a better prognosis in terms of the treatment itself. But there are others who present quite late in terms of where you have at least more than 50 to 60% of the body being involved. Now, unfortunately, when that happens, people will be thinking, is it something like albinism? But that is a completely different kind of a skin manifestation in terms of what it is and how it's diagnosed is completely different. Patients with albinism will present with no pigment at all, because you definitely have a reduced potential of making the melanin, but not the melanocyte having the problem. So we have different, there are 4 types of albinism, and they will present differently. The most commonest type we see in our part of the world is basically the type 2, which is basically a lot of more of pigmentation in terms of absence. But vitiligo, you see, it's basically someone who had the pigment and then lost it at some particular point of time, and it was progressive in that particular nature. So as it progressed, the patch became larger and larger, it kind of involved the rest of the body. So that way you can definitely, I mean, a dermatologist would easily pick it up. So in terms of patients out there, those are different diagnoses. So don't get too worried. Don't read too much online, because the more you read, the more sometimes you get worried, and then you see that, unfortunately, there's no treatment available, and that becomes a bit of an issue.
Let's understand vitiligo further. We have learnt of the different types of vitiligo. So Simon Kariuki was diagnosed with vitiligo more than 10 years ago. He is now 32 years, meaning he was diagnosed with vitiligo during his adulthood. This bringing the fact that vitiligo can affect anyone at any stage of their life. For Simon, people thought it was due to alcohol. For one, Simon was an alcoholic. So people thought the patches were due to excess intake of alcohol or just injuries he got from either falling or hitting himself.
Actually, it just started as a small patch. I didn't see much about it, but now progressively through the years, it has been spreading to parts of my body. Is the forehead. Actually, the lips, there's a time the lips were more, the patches were more visible on the lips, and also in the feet, the groin area. This is where vitiligo has been very much been spreading. Actually, I did not even consult. I just assumed it. I didn't see something big about it. But later, that's when I came to realize that this patch has been increasing. Now it actually started from my left arm. Then now it shifted to the other arm. It shifted to the other arm. So I did not see something big at that time. And the other parts like the feet, that one it came later. So actually there's a time that just like the season that there's no the patch is not increasing, and then all of a sudden maybe like 2 months, 3 months, start seeing another change in the patches, become much more spread. And that time you are in addiction, and the moment now people start saying, you are being told, oh, you fell, you are drunk, you fell down. So having now to explain to somebody, no, this is actually a disease, and then they really tend to wonder what kind of disease is that, because even actually most people don't know about vitiligo, so most people don't know about how it normally appears. So when somebody just sees maybe like it's a wound which is healing, they normally now equate it to a wound which is healing. And also like appearing in the lips, people also will tend you to look at you, and then they say because you have taken too much alcohol, that's what is burning your lips. That is what. There's a lot of stigma actually, because also most of the people not tend to want to relate to you when you have vitiligo, those who don't understand about what is vitiligo. So because they think also that maybe even when you touch something or you share something, you'll be able now even you'll be able to spread to them. That actually that is a lot of stigma. So sometimes last year I was able now to seek treatment in Nakuru, but only being treated for 5 months. Only responded within only the first 2 months. Then things stagnated from there. And also the doctor asked me about the family history of vitiligo, so I was able to explain my grandmother's, from my grandmother's side, the one somebody was suffering from vitiligo. But coming back now to Nairobi, I sought treatment at a clinic in Nairobi, and the doctor was able to tell me that I must be exposed to UV light. That is what I started the UV. Told me about 2 sessions per week, and the exposure time, it was going as I also attend more sessions. That is when they also tend to increase the time I'm being exposed to UV. So that is what I've been doing. But also the doctor told me it will not be on an instant basis. I'll have also to eat, and actually told me also that it is not that guaranteed that you must respond. So it all depends. Normally depends now with how you respond to treatment, how you respond to UV. That is within now 2 sessions per week, going increasing time. And also there are some medications that they also gave me to the ointment to apply, and also some tablets on a daily basis for the first. He gave me a dose of 3 months. Now after that, they'll able now to get a review.
Okay, so you have a different perspective from other dermatologists
Yes.
that I've interacted with.
Yeah.
And you say there is treatment for vitiligo.
Yes.
So how do you make those having vitiligo to embrace that there is treatment and for
Okay.
them to seek treatment?
So with vitiligo, you see, unfortunately, what everyone thinks is that there is no treatment out there, which is a myth. Unfortunately, and that's the reason why people present late. Now, vitiligo, especially if it comes early, like I said, you see, it depends on the pathogenesis and what the patient presents with, and how you would get particular amounts of history from the patient that would allow you to see which type of vitiligo it is and how long it has been there. Now, depending on how long it has been there and how big the patch is, or whether, like I said, trichromic or different particular dichromic, for example, there are different treatment options available. And we start with topical management. Topical treatments are available. And then if those don't work, definitely we move to something called phototherapy. And if those still don't work, we go to oral management. But like I said, vitiligo treatment is something very, very robust. There's a lot of things coming up right now. And if you see our colleagues in the West, we have something new in the pipeline, which is called JAK inhibitors. JAK inhibitors are a new range of vitiligo management that has been used off-label. And that has shown very promising results in a very short period of time. So in terms of treatment management treatment or management options, there are quite a few depending on how late you come or how you present. Now it depends also, like when you say that there are no treatment available, that may be very true for someone who has more than 60% of the body being involved. With that particular scenario or that particular diagnosis at that time, that becomes very difficult to treat. So you see, at that time, I would say no treatment would be available for such a patient. But you see, if he knew that maybe treatment would be available and he presented earlier, that might have changed for us.
As said, genetics is a risk factor, but the condition is not life-threatening. However, the skin being the largest part of our body, as the vitiligo patches spread, this could affect one's self-esteem, leading to depression.
You have to understand that skin is the largest organ of the body, and your skin is your reflection. So anything that touches in your skin can affect your esteem, and vitiligo being one of the condition, it will touch on your esteem as well.
So even when you now, if someone tells you like what you're suffering, there is no cure for it, you will start to worry a lot. It worried my parents. Back home, people will look at you differently. People will think you have cancer. So many things, you are cursed, or just so many talks. And when people talk like that, you get depressed. And when you get depressed, there is nothing you can do. So many people living with vitiligo, they don't normally come out to, like, they don't want to show themselves to the outside world. They fear, so they keep themselves locked.
There's also that kind of self-esteem, because seeing that people don't want to relate to you, or maybe when you touch things, and also relating to the other gender, the ladies, maybe you'll talk to somebody and then people to look at you and then no, kind of disease, and considering that that time I was in addiction, there is no way I could be able even now to be able now to even convince somebody just a normal disease, a normal skin disease. That is what really affected me. Also your self-esteem, you don't like, when it was appearing in my forehead, most of the time I used to be on a cape. I used to wear it on a cape. that maybe somebody does not, people now, everybody sees you and there you look and then says, oh no, this is alcohol related, something of the sort. Yeah.
So you see, mental health becomes very, very important in such individuals, because that itself, their self-esteem, what they're looking at in front of a mirror every day, definitely causes them to have a problem, especially those ones with acrofacial, what we call the ones which is the lips and the hands, because those are areas which are easily seen, and it's very difficult to camouflage such particular vitiligo as such. So you see, when that becomes a problem, seeing that every day, you need to consider that when you're treating the patient as well, and try and make sure that you also make sure that not only is the patient treated in terms of the topical or orals or what, but in terms of mental health is also pretty and in a good place. Yes.
How is it like for your parents?
They were worried. It really worried them. Yeah, and now the way people used to talk ill, like people talk ill in the community. People think that people will just think like they have used you for some wealth or those traditions, you understand? Yeah, so it really worried them. Like, and I'm actually, once I accept myself, I told them like, don't worry, this is a condition, I'm the one living with it, and I've accepted myself. So you also just have to accept me. Yeah, and life just continues.
Do you have other siblings?
I have siblings.
So are they also affected?
No, not really. It's just me in my family actually. It's just me who has vitiligo in my family.
Simon and Felix have embraced their vitiligo, overcoming their fears, and this has made them lead a more fulfilling and confident life.
So other people think when they see you, they think that you have a contagious infection that will affect them, you see. So they will tend to move away from you. They will want to associate with you. And when you can't associate with people, you will get depressed, you see. Like you will just start to feel like you are not fit there. Yeah, so even at school, but what we're doing, we're just trying to create awareness so that people tend to understand what's vitiligo. Vitiligo is all about acceptance. If you accept yourself, everything will just flow. You'll just go to the outside world. People living with vitiligo are just the same. It's just that their coloration, they have two colors. Yeah. So it's just basically that.
When you meet somebody who does not understand what is vitiligo, being able now to explain to them, this is a kind of disease. So actually that is how I've conquered it. Being now to inform somebody who does not know about vitiligo, you just try to explain to them what is vitiligo, and you see most of the people will tell you, I didn't know about that vitiligo.
And if you happen to come across a person who is having vitiligo, the things that as a mental therapy you'll notice about him: first, the esteem, the anxiety, the image, how people look at him, and how does he take that. And I think this is a group of people that they really need a lot of mental, in terms of counseling, because some of the mental burden can also be brought by the economic burden, the treatment, where you work. How do people see you when they look at you? You see, all those things can lead to self-esteem, anxiety, suicidal thoughts, and I think that is an element that is very important when it comes to management of vitiligo.
Embrace the vitiligo itself, because vitiligo is not something that you need to be, unfortunately, embarrassed about, or kind of reduces your self-esteem. People are out there who are doing so much more, even though they have vitiligo, because you must have seen some models who are having vitiligo. You must have seen some really prominent people in society who do have vitiligo, So that kind of thing. More of embrace it, own it, and do well with it.
We have focal vitiligo, which you can happen to have a change of color just in a certain point in your body, that is focal. Then we have segmental, the one that can only affect one side of your body. We have a universal. Universal, this is the most severe type of vitiligo, in which you may have a total depigmentation of approximately 80% of your body. And you also have generalized vitiligo and acrofacial. The acrofacial are the one that are affecting the lips, the eyes, and sometimes the opening, the genitals part. So those are some of the types of vitiligo. So progression of vitiligo may depend on the type of vitiligo. Like those with the universal type, the progression are usually very fast.
Yeah. I think for our viewers and for any patients who do have vitiligo or are suffering from vitiligo and see that they might be in a place that they might not be helped, do try and see a dermatologist. Whenever you see a dermatologist, it's not that they will just kind of see what exactly is going wrong. They will also see if there's any complications that have happened because of the lack of the melanin inside. So we always definitely we'll try to treat the vitiligo as such, but we'll also give you definitely some tips to actually manage the skin in terms of what other problems can happen later on as well. Yes.
As we wind up today's show, let us have a recap of what we've learned about vitiligo. One is that vitiligo is a skin condition in which the skin loses its natural color, the appearance of white patches on the skin being a sign. Also, vitiligo is not contagious, and the most important thing is for us to embrace those with vitiligo in the society and stop stigmatizing. Feel free to share comments and questions, and also suggest different health topics that you would like to learn more about, and we will be happy to respond. That is all we had for you on today's show. Remember to tune in every Monday at 7:30 p.m. right here on CAC TV, and let us learn together and be enlightened on different health matters to improve our health and well-being. I've been your host, Aida Munzatsi. See you again next Monday, but always remember that your health matters.